Hi, my name is Mariam Shelton, and I am currently finishing up my junior one semester at USF. A little bit about me: I grew up in Ashland, which is a very small town in southern Oregon, with my parents, five siblings, a bunny, and two cats. I love to be outdoors as much as possible and stay active, whether it be hiking, camping, swimming. I love to work out in the gym, I love to cook, and I'm very passionate about gymnastics. It's something I've done most of my life, and even though I don't compete anymore, I still try to find time to do it for fun on a regular basis whenever I can. I currently live in San Francisco, and along with having a very heavy school load, I am a nanny for a 9-month-old baby girl, and I also try to find time to see my friends and go to the gym and live an active and healthy lifestyle. Throughout my high school career, I have held various volunteer and work positions, including being a summer camp counselor for children of various ages, as well as a gymnastics coach and a nanny for many of the families in the town where I lived. I started working as a waitress when I was 18 years old, and I think that holding that job has really helped me develop many of the skills that I hold today and that I believe are going to make me a great nurse one day. It taught me how to multitask and how to prioritize, and being from a very touristy town, it allowed me the opportunity to work with and communicate with people from various cultural backgrounds and interact with people from all walks of life. I think that working in such a high-stress and ever-changing environment really taught me how to adapt to situations and taught me how to be professional and have a strong work ethic, and I know that these qualities will help me immensely in my career as a nurse. I have always had an eye for small details. I am organized, respectful, and I am never late, something I learned from my mom. I want to say how excited I am that UCSF has opened up more spots in their partnership, and I feel honored to have the opportunity to apply and show you a little bit about why I think UCSF would be a great fit for me as I head into my last year and a half of clinical rotations. I come from a family full of medical professionals. My grandmother was a nurse, my mom is a nurse, and both my grandfathers are physicians. I have heard firsthand of the excellent care that UCSF provides their patients because my grandfather worked there as their clinical professor of urology in the late 80s. My passion for nursing really began when I was 9 years old and when I had the amazing opportunity to witness my cousin be born at home and welcomed into this world in such a calm and peaceful setting. At age 9, I became fascinated with just how miraculous and strong a woman's body is, and since the day my cousin was born, I knew that I wanted to pursue a career that would allow me to work with women throughout their pregnancies and really be an advocate for women's health. I've been fortunate enough to witness many more births since the day my cousin was born, and I have such a passion for the birthing process and empowering women when it comes to delivering their children. I'm especially excited about the opportunity to potentially pursue my career at UCSF because I believe that as nurses and doctors, we should respect every family's birthing wishes and work with women to ensure that they have the best birthing experience possible. And I know that UCSF shares many of the same values that I do when it comes to promoting a more natural and alternative birth experience. I really respect UCSF's goal to improve maternal outcomes in this country, and one of the ways that they are doing this is by helping to reduce primary C-section rates to a level that is more in line with the World Health Organization's goal of keeping C-section rates under 15%. After immersing myself in the field of labor and delivery, I envision myself going even farther and pursuing further education. My experience at UCSF could potentially lead me to either a neonatal or midwifery advanced practice nursing degree, and I know that UCSF is recognized as one of the top nurse midwifery programs in the country. Even though I've had fantastic clinical experiences at my clinical sites over the past year and a half, the last year of clinical really focuses on maternity and pediatric nursing, and that is the area that I'm so passionate about, and I would feel so honored to have the opportunity to finish up my clinical rotations and pursue my career at one of the nation's top hospitals and a place where people from all over the country and even the world come to seek care because they know the level of excellence that UCSF can provide. So why UCSF for me? I think that it will be the best fit for me because I want to be in a clinical setting where compassionate and respectful care is provided across the spectrum of socioeconomic and cultural differences. When one person suffers, we all suffer. We are connected as a human race and as a community, and so it is imperative to offer the best care to everyone, regardless of their gender, race, background. And I know that UCSF is recognized as one of the top hospitals in the nation that provides care to people from all over the world. Thank you for your time and for considering me to be a part of UCSF's collaborative team.